In this video, we're going to talk about shoulder pain and some of the exercises that you can do. So most people come into our office for shoulder pain, and usually it's a bursitis or tendonitis or impingement syndrome. Anytime you see a word with an itis, it's usually inflammation. So bursitis is like inflammation of the bursa. You have a bursa sac that's here in the shoulder area. So you have your humeral head, which is this part right here. It's almost like a ball and socket type of joint. And this is part of the scapula muscle, the scapula bone. And so there's an area in here, and then there's a space in between here, and that's called the subacromial space. So anytime you have a bursitis or tendonitis, the bursa is inflamed, the tendon could be inflamed, and those areas, either one of them can cause impingement syndrome, which is just narrowing of that space. And most of the time in the tendonitis, it's going to be one of the rotator cuff muscles, which is the supraspinatus, infraspinatus, teres minor, or the subscapularis. And often when a person does come in with pain, they usually come in and they tell us that I have pain in my shoulder. It's just generalized pain. Or when you push down or press on that area, there's pain. Or when they try to lift their arm, they can lift their arm, it just hurts a lot. Or when they try to do circles, that hurts a lot as well. Also, when they're opening a door or when they're pushing on it. But most of all, the common symptom is when a person is awakened at night because of pain in their shoulder. So there's a few things that you can do for that. You've got to first rule out rotator cuff tear. You can have a full tear, you can have a partial tear. Most of the time a person cannot lift their arm, or if they do lift their arm up and it hurts and they need a little help, and as soon as you let go, it's just like their arm drops. They have no control of motion in their arm here. They can lift it, but it hurts, but they're helping you. They're helping their arm, and as soon as they let go, it drops down. There's just no control of motion, of that control of the joint, of the muscle. So what can you do? Well, if you have one of these overuse syndromes that usually causes it, people that are working out doing this, an athlete that's throwing or hitting a lot, you can see that with a person, even anything that involves with the shoulder joint. You really need to stop doing that. You got to give it a rest. And I hate to say this, but it does take time. It might take up to 4 to 6 months for a person. It just depends the current health status of the individual. So what you can do is you can put it in a sling. Okay, so you want to give it a rest, is put it in a sling. You can ice it as well. That's number 2. Number 3 is you can take NSAIDs, which is something like Advil, or you can take Motrin. Okay, you want to make sure that when you're sleeping, you sleep in a comfortable way that is going to allow for healing of that joint. As I mentioned before, people lie on their injured shoulder and they go to sleep. Don't sleep on that shoulder. That's all you have to do. And I'm going to show you a way that you can just grab a pillow, and let's just say this is my left shoulder is injured. When you are sleeping at night, just lie on your side, and you want to rest your shoulder or your hand here over the pillow. Okay, that is how you want to sleep, because if you're sleeping just like this, it's pulling on my shoulder, or sleeping this way, it's pulling on my shoulder, and this just takes the pressure off of it. So you want to make sure that you're sleeping in a very comfortable way. So there's a few things that you can do. These are some stretches that you can do pretty much anywhere. You can do them throughout the day, 2 or 3 times throughout the day. One is just a posterior stretch, where you put your arm here, your hand is trying to touch the other shoulder, okay? So what you're doing is you're pushing down, you're holding and you're stretching this for like 15 to 30 seconds. You want to do this 2 to 4 times. Same thing here, over, and then you can just push, give it a little bit of a stretch, and you're going to feel that in there. The other one is squeezing. Number 2 is squeezing the shoulders. So you're getting your shoulder blades to go back. See, you can see like right now I'm going back. Okay, that's another one that you can do. Hold it for 6 seconds. You're squeezing, and do that 6 to 8 times. So that's number 2. Number 3 is basically you're working your scapular, that big chicken bone as we call it, but the scapula bone. You're shrugging up, you're holding that for about 5 seconds, and then you're shrugging down, you're like going down for another 5 seconds, and then you can do 5 circles forward and 5 circles as well, back, forward and backwards. So that's number 3. Number 4 is a chair exercise that I have a chair right here. So I'm standing right here in front of the chair and I'm just walking back. And you see how I'm opening up this whole space and I'm walking back. Giving that a stretch. You can hold that for about 5 seconds. You can do this throughout the day. So you're going back and holding that for a few seconds. You can hold that for 5 seconds. Everyone's a little bit different, so do that at least 5 to 10 times every hour. Even if you just do it once, like you get up and you're, oh, I only did that once. Well, okay, try to do it 5 to 10 within an hour. I like to just crank out about 5 of them just to get some stretching in there. So other things we can do. We got a couple other little exercises that you can do is, let's just say your left, this is the bad shoulder, the left one. You can grab a towel and I'm holding it there. You're pulling that up. You see how I'm just pulling that up? I'm holding that and just working my way, pulling that up. It's like you're sliding back and forth. You can do this. Like I said, only have these stretches you can do 2 to 3 times a day. You know, you can do this about 5 or 6 times. The other one is actually working your some of the rotator cuff muscles as well. So there's a few that you can do, and one is you're going to lie on your side. So you can use, if you don't have weights, this is just a little weight. You don't need a lot for your shoulder. So this is just a baby weight. It's 3 pounds. And I'm just going to lie on my side here, and I'm bringing this towards the middle. You see how I'm doing that? I'm going to do that about 8 times. Just bringing it towards the middle, super slow. Okay, you can use, like I said, like a can. Okay, doing that. And then you can do another one where you're going out. Okay, and you don't have to go out a whole lot. You see how I'm doing that? And you can use bands. You can purchase a band at probably any store, any like Big 5, Walmart, Target. There's also bands that you can do. The whole point is you're moving. You're also, you have that resistance, bringing it this way. There's some that's pulling you this way. Okay, others where you're pulling back this way, and others where it's pulling it forward as well. So those are some other bands that you can do. Another thing that you can do, it's super easy. I'm using the back of the chair is I'm putting my hands here. I'm resting my hands and I'm just squatting down. Or you can also get a higher counter. Like if you have a bar counter, put it at the top and just squat down, or you can just hold it there. Or if you're even a little bit more, you want it to be a little bit more aggressive as you get a little bit stronger. You don't want to do this from the get-go. You want to work your way up. Is put your hand on, both your hands palm down on like a cupboard. Okay, like in a kitchen cupboard. And you can just feel that stretch. So you're going to be up higher. So you want to start really with the low one. Like right now I'm pretty low. And I can also go down this way. Those are just some other stretching exercises. Most of all, when you're sitting, you want to make sure that your posture, you have a nice, you're sitting up properly. If your shoulder's bothering you, if it's your left shoulder, when you're sitting down, try to support your shoulder instead of letting it hang. Maybe you have a pillow, or maybe you have a chair that you can let it rest, and that's going to give you some support as well. Also, you can use a back brace or a back support when you're sitting on a chair. Sit down, put this in the small of your back so it's forcing you to sit up, because a lot of us are sitting too much with our work or at home, a lot of us who work from home. So there you go. Those are a few exercises that you can do. I hope that they help, but most of all, you've got to keep the inflammation down. The way you're going to keep the inflammation down is, one, not use it and ice it, but also an anti-inflammatory eating template, which we have it's a diet that we've been using for years. You go on our website and you can download that, start following that as well, and you will see results. It is going to take time. It doesn't get healed overnight, because it did take some time. As I said earlier, it may take as much as 4 to 6 months to heal this, so just be patient with yourself.